I would recommend a rural placement because of the wide range of clinical scenarios you're exposed to and the wide variety of learning opportunities. And from my experience, the preceptors are always really eager to teach the students and are super knowledgeable. So I've had great experiences in rural placements, and I always recommend it to other students.
So some benefits to expect from a rural placement would be to try something new that's maybe out of your comfort zone. And also for me, having the chance to kind of dip my toes into something that I knew I was already interested in without having to go commit full-blown was beneficial.
My name is Kirli. I'm a fourth-year pharmacy student, and I chose to go to Brandon for my hospital rotation because I had heard lots of great things about it, and I thought it would be a good experience to see a little bit more rural pharmacy.
My name is Paige. I'm a student occupational therapist, and I did my intermediate 1 placement in Thompson out of Thompson General Hospital. I chose to go to that community because I was hoping to gain some experience in a rural setting, and I really enjoyed my time there. I think the North offers such a unique opportunity for learning.
My name is Mary Strain. I'm a second-year medical student, and I was on a rural placement in Poplar River First Nation. And Poplar River First Nation is a fly-in community, and that's especially why I chose to go there.
I'm a pharmacy student, and I recently did a rotation in Pilot Mound, Manitoba. In terms of accommodations, the university kind of finds places for you and takes care of that, which is great. And for Pilot Mound, they actually had me in a cabin that was overlooking a lake in a nearby community, which was really cool. It was just like 10 minutes away, so very convenient.
The Rady faculty set me up with an Airbnb, and I was with a midwife student for the whole time. So it was really interesting meeting someone new, but then also the living situation was great.
Everybody in the community, it felt like it was really tight-knit, especially within the interprofessional team out of the hospital. Everybody was really welcoming and wanted to make sure I was making the most of my time there, so I felt like I was kept busy the whole time I was there.
When students go out into rural and northern, they do depend on team-based care. That's my experience. They have the opportunity to work together, sometimes to live together, and to experience what that whole rural living is about, and also what their contributions are as professionals. So whether you're a physician or a pharmacist or a nurse or a rehab specialist, how do you actually work together and serve patients to the best of your ability?
For our healthcare professions, a rural rotation is absolutely essential. Our programming within our undergrad or graduate programs within the Rady faculty has a limited capacity to provide students with the structural knowledge that is necessary to be able to care for patients who live in rural and northern areas in Manitoba. And having that exposure or experience both in the onset of your training as well as later on in training is key for those of us who practice within an urban setting to be able to care for patients who are from rural and northern areas.
This gives you a chance to see what's out there, what services look like in the north and rurally. Even if you aren't considering working rurally, this is a good experience to see what patients that will be coming into the city deal with or live with on a day-to-day basis and what actually exists for people back home.
I've been able to do a couple of rural rotations, and I really like the opportunity to have a change of scenery, kind of all taken care of by the university. I already work at a chain pharmacy in the city, so I already know what that's like. So I really appreciate having the chance to go for short periods of time and have a really different experience.
I really got the full generalist experience. So because it's one hospital that serves a large area, so lots of different communities, you get to see everything and do a lot. I got to work in outpatient hands on the acute care ward and pediatrics. I got to do a little bit of stroke rehab, some home visits.
I enjoyed the flight in. There were only 4 of us on the flight, so it kind of felt like we were in a private jet. And also the scenery from the sky in the north was stunning. I would 100% recommend rural placements.